Well, in the NHS, student doctors are to be drafted in to help keep hospitals running, a daunting prospect for many students given the scale of the coronavirus challenge. Our health correspondent Ashish Joshi has been speaking to the medics called up early.
Last week, this 23-year-old was a medical student preparing for his final exams. Now he's joining the NHS front line in the battle against COVID-19.
I am probably ready to go, but it is a lot sooner than I would like to be doing that.
All final year medical students and student nurses are being asked to join a so-called NHS army. David, and that's not his real name and this is not his real voice, told me the call-up has left him confused and a little bit frightened. Are you worried about your own safety?
Yes, to some extent. Obviously, we're going out there is a massive risk, and we're trying to take all these measures where we're not getting exposed to it. PPE is running out. I'm not sure that I've been briefed enough to know exactly what I'm meant to do, where the high-risk areas are. We shouldn't be going into.
The NHS will need all the help it can get as it steps up to face the greatest threat in its history. But fears around staff shortages have long existed. In 2018, the Faculty of Intensive Care Medicine issued this stark warning. Finding critical care beds for patients is becoming a threat to the quality of care. Clinicians are now deeply concerned that quality of care is being compromised. If this issue is not addressed, clinicians fear that patient safety will eventually be compromised too.
Obviously, it's what I've been training for the last 6 years, so it's humbling to be able to help when there's such an emergency.
Julia Simons is in her final year. She's ready and doesn't want the government to waste any more time when so many lives are at stake.
We're a group who are really willing to help. We've organised our own initiatives whilst waiting. For example, some medical students have signed up to be healthcare assistants, medical students have set up childcare networks for doctors, and yet while our medical schools have been exceptionally communicative and tried their best, there isn't really any clear guidance about what happens next.
We know there's a shortage of NHS workers. The current vacancies for all staff in all of the NHS stands at just under 100,000. These are often filled by agency or temporary staff. Over 38,000 of these vacancies are for nurses and over 8,000 are for doctors. As critical care units begin to fill up, hospitals will try and increase capacity. We know that they're already cancelling non-urgent operations and other areas of the hospital are being used, like theatres. But beds on their own aren't the answer. What they need is extra staff. Julia and others like her have spent years preparing to save lives. That time has come. It's just a little sooner than she expected. Ashish Joshi, Sky News.
From next week...